So we're going to start from the top. So we're going to talk about weight management, and we're going to about it in a way that's actually very realistic and it's grounded in the evidence, talking about biological, physiological drivers, not based on guilt, shame, blame. So the goal of this presentation is not to give everyone another set of rules, is to really filter out the noise. There is so much noise around weight maintenance, weight loss. A lot of people think they have this like strategy that is going to be life changing. And I want to make sure that we have a really clear idea as to actually what the evidence says about this. So, for those who don't know me here, um, I'm Dr. Jules Passy. I'm a naturopathic doctor at Flow Functional Healthcare. Most of the concerns that I see are focused in women's health through different hormonal transitions. I treat a lot of digestive concerns as well, so IBS, inflammatory bowel disease, celiac disease, conditions like that. And then now I have a large focus in weight management, weight loss, and metabolic health. So, over the course of the year, I've been completing a fellowship in obesity and metabolic health that's really changed my outlook and my ways that I can support my patients, giving them a really good foundation in evidence. So let's dive into it. So, I know the heading of this presentation was a lot about nutrition, but before we dive into these tactics, we really want to acknowledge the mental load of weight, right? A lot of times when we're talking about weight loss, we're thinking about how much brain space it's taking up, constant food decisions, what our next meal is, what snacks have enough protein, what cravings, exciting foods we're thinking about, what restaurants we should eat at, what are the fat content of these things, how are they going to make us feel, what do we do at social events, what are we doing when we have company, and then there's a lot of comparison and often a lot of shame around these decisions. So when our weight doesn't change when we're putting in a lot of effort, it usually feels very personal, right? People assume that it's their fault, right? They take responsibility, they blame themselves, but that's actually weight bias. It's factoring in or making it seem that your weight is a direct reflection of what you're doing wrong, and your body size is a direct reflection of these choices as well. But that's actually not factual. Weight regulation is largely biological, and essentially, it's driven by a lot of different factors, largely genetic. So, genetics actually drive a lot of weight changes. Then we factor in hormones, we factor in stressors, body composition, traumas, mental health, energy levels, sleep. Honestly, the list goes on and on. And we compare our bodies to often a different time in our life, right? So it's not just comparing to other people, but a lot of people idealize, if I said that right, a version of their self that is just like no longer true, right? In your 20s, maybe you had less responsibility, maybe your career had a lot less stress, maybe you had more energy, more capacity, maybe you had different health conditions, maybe you didn't have kids. We can't compare where we are now to a version of ourselves 30 years ago, 20 years ago, sometimes even 1 year ago, right? Because the context of our life changes substantially. So we really want to factor in how all of these things are driving how we're feeling currently. And once we understand our biology and the interaction of all of these variables, we really stop putting all of this blame on ourselves, right? Um, I'm just going to quickly check the chat here. Oh, Fran has got them. Okay, beautiful. Okay, so let's keep going. So when we're talking about weight loss, we really want to factor in what's realistic because I have a lot of people have unrealistic goals. So when we think of just starting from the top, it's very unlikely you will ever be able to lose more than 30% of your highest adult non-pregnant weight, right? Weight loss and weight maintenance are also very different, and I'm going to move through that moving forward. 5% of weight loss is very meaningful. We tend to see very big shifts in a lot of different metabolic conditions. Your blood pressure, your blood sugars, we can see shifts in hormones. Sometimes in individuals with PCOS, this means more regular cycles, better ovulation. We can see changes potentially in like sleep apnea. Like the list is very, very long, but oftentimes we have this weight loss goal where we're like, we want to see weight loss and we want to see it very quickly, like a large amount of weight very quickly. When we think of like what successful weight loss is, it's 5% of your body weight within the first 3 to 6 months of intentionally trying to lose weight. So when we break that down, oftentimes that's not as much as you think it is. So in someone that weighs 200 pounds, 5% would be 10 pounds, 10% would be 20 pounds, right? So if you lose 20 pounds of your body weight within 6 months of trying to lose weight, that's incredible. That's very, very successful. But oftentimes we always feel like, oh, that's not enough. It should be more. So it's important that we know what that looks like. When we're thinking about caloric deficits, we do not want to be in more than a 500 calorie caloric deficit. And I will teach you how to calculate a caloric deficit because this is based on maintenance calories. Most people have no idea how many calories they should be eating in a day. So we're going to figure out how we do that as well. When you're in more than a 500 calorie deficit, it's very hard to maintain that over a long period of time. And this is often why we see people rebound. It is slightly different on people that for people that are on medications because it does change more variables than diet and exercise alone. But yes, 500 calorie deficit is typically the biggest deficit we would ever want to use when we're thinking about weight loss. And when we actually do the math on that, 500 calorie deficit per day is about a 1 pound weight loss per week. Right? So in a month, that's around 4 pounds, assuming everything is going perfectly. A 250 calorie deficit would be more like half a pound a week. So we're looking at more 2 pounds per month. And then when we think about it, in that 3 to 6 months, we're looking for, again, a 5 to 10% weight loss, recognizing that, again, that is very successful. So, thinking about the different types of interventions, because a lot of times the first thing people move to is like, I'm not eating enough. I mean, not eating enough. I'm not exercising enough. We feel that exercise is typically the key to weight loss, and we've been told that exercise helps us lose weight. It does, but exercise alone does very little for weight loss, right? It's a very, very small percentage. So if you were to increase your exercise substantially, likely the most amount of weight that we'll see change is about 3%, right? When we add in nutrition and caloric deficits, then we're looking at more like that 5 to 10% weight loss. It's very hard to go above 10%. I know we feel like we know people through nutrition and exercise that have lost a substantial amount of weight, but that definitely is the exception and not the rule. The other thing when it comes to nutrition and exercise is the weight loss and the weight maintenance. It's very hard to maintain weight loss through nutrition and exercise alone because there's so much pressure into keeping into those habits so strictly, right? Medications are an amazing tool. There is a lot of judgment around medications, and that goes back to the weight bias, right? That we assume that weight is associated with the dietary and lifestyle habits that people have, when that's actually not factual. When we think about different medications, there's so much less judgment, right? If your thyroid, if you have Hashimoto's thyroiditis and it destroys your thyroid function, we don't judge people for going on Synthroid. If you have high cholesterol and it's genetically driven, we don't judge people for going on cholesterol medication, but it seems to be a bigger issue when we're thinking about weight loss medications. Typically, the main types of weight loss medications we're looking at, because there are several different types. The one I won't be talking about in as much detail is Contrave. So Contrave is a combination of bupropion and naltrexone. Typically, this medication is more involved in quieting the noise around food in your brain, but it doesn't have the same effects as our GLP-1 medications. So GLP-1 medications are semaglutide, which is Wegovy, and Ozempic. So this is a great medication. Typically, we're looking around, and again, bear in mind when we're looking at this percentage of weight loss, we're looking at a number of things. One, what dose are people on? What comorbidities do they have? How long have they been on this medication? Body composition, nutritional and lifestyle support, all of this changes the amount of weight people are able to lose. But typically, most people can lose more than 10% of their weight on semaglutide, and it might be even more. Tirzepatide, which is Mounjaro, and Zepbound, we tend to see a greater amount of weight loss, even at lower doses, because of the added effect of the substance called GIP, right? I know this medication has a higher price point, but it does have greater efficacy for a lot of individuals. There is a new medication, and it's still in trials, and I'm going to butcher the name here, but it's retatrutide. So this one is, I call it a 3G. So it's GLP-1, it's GIP, and it's got something called glucagon. So this will be the only medication. So this addition of that glucagon is something that increases something called your resting energy expenditure, which I'll go over in more detail. But this is where typically we'll see even greater efficacy than we do with the tirzepatide because of the added benefit of that glucagon, right? Bariatric surgery has the highest efficacy for weight loss, meaning you can lose closer to that 30% of weight. Many individuals that do have bariatric surgery, also we do combine that medication post-surgery to help with that weight maintenance over the long term, right? These are great tools and they help people not just focus on diet and exercise, because diet and exercise alone, we can see, and we see time and time again, it's typically not enough to do over the long term. Often we need added support, right? Does anyone have any questions about that? So weight loss versus weight maintenance. A lot of us talk about weight loss. We have a goal weight. I want to lose 10 pounds. I want to lose 20 pounds. I want to be 160 pounds. Weight loss is actually much easier than weight maintenance. So weight loss is the beginning, right? This is the initial period, even if we're thinking about a lot of studies and going back to the usage of medications, a lot of studies, we have to remember people are in this beautiful bubble, right? They're given awesome nutrition advice. They're being told how much to exercise. They're doing lots of follow-ups. They're given all of the supports that we need. And in the real life, or in real life, we don't have that. Which is where a lot of times when people are given medications, they aren't well supported and they're not given realistic expectations for what the long term looks like. And this is something where it's like, you're not supposed to do this on your own. You're supposed to have support. You're supposed to have guidance. You're supposed to have check-ins. We like to mimic this as much as we can because it's just really impossible to be able to do all of it on your own, right? So weight loss, going back to weight loss is that drop in weight. Weight maintenance is way harder. When we lose weight, our body has this mechanism where it feels unsafe. It always wants to drive us up to our highest adult weight, it's like this is where I feel comfortable. So when we drop weight, essentially there's this uncoupling effect in our physiology. So what happens is our resting energy expenditure, again, I'm going to go over that in the next slide or two, goes down. So the amount of calories we burn in a day goes down. And then our appetite is driven up. It wants us to actually eat more, which is why we lose weight and it's very, very hard to stay there. We need a lot of tools to help compensate for this adaptation where our body's trying to drive us back up to a higher weight. So we don't typically actually achieve weight maintenance until we've maintained weight loss for a minimum of 2 years, but better yet, it's more like 5 years. So we're talking about like long-term plans when it comes to your weight.
Dr. Passy, do you want to answer the question that Rosie had because you were just talking about long term? So she's asking,
Yeah.
take breaks during long-term journeys after 18 months of deficit, then go back to deficit. And Rosie, if you want to come off mute and ask, give any further context, go ahead.
Yeah, I had really good progress, and then I've tabled off for an entire year and stayed there, and now I want to get to that next. But I'm wondering, have I tried to diet for so long that I need to take a break from it or something? Like all this cycling, all these messages, there's just so much out there.
It's so confusing. So we are studying this, and this is actually a wonderful question, right? When you're in a caloric deficit for too long, your body does adapt to that deficit, right? So if you're eating, and I work on this a lot in my weight loss group right now, because there are actually a lot of people that don't eat enough, right? When we think about what their resting energy expenditure is, and they're eating under that, and they're eating under that for too long of a period of time, and their body is like refuses to lose any more weight. What we see in a lot of people is exactly kind of as you asked, is we kind of go into more of this maintenance flow. So we find the amount of calories you can eat without gaining weight, without intentionally trying to lose weight. And we kind of sit there for a period of time, and then we try and go back into that caloric deficit. And we've seen it in studies in different ways where this is actually more successful for the long term and helps to actually reduce this metabolic adaptation. So we see people actually have better resting energy expenditure when they take actually vacations from that caloric deficit. The challenge is a lot of these studies are still fairly short term, where it would be like 4 months, right? Sometimes like in those studies it's people that say 5 days out of the week they're eating 500 calories less. On the weekend they do their maintenance calories. So over the week, if we do that 500 calories times 5, they're in like a 2,500 calorie deficit. The weight loss might be a bit slower, but their body like sees that as more of a shock and tends to respond to it. So definitely when we see people go in this like linear, or when they're in this chronic like trying to lose weight for too long, we see more of a plateau, and we see a flat faster plateau versus people that kind of go, then they balance, and then they go, and then they balance. Of course this journey might look different for each person, but that is typically what we're trying to do, just as you asked, is we take a break. Some people have very intentional vacations over holidays, or plans where it's like they're going on a cruise and they take the vacation, or they're traveling, or over Christmas or over Easter. And we're like, that's actually a really great idea rather than just trying to be in a caloric deficit for months or potentially years on end. Does that help, Rosie?
Yeah, just wondering, how long should you stay in a deficit before you take a break and then continue again? Or is
Yeah.
it 5 on, 2 off a good way? Like, I don't know.
No, so that's just one example. So there's studies where it's like 2 weeks on, 2 weeks off, and I think that that's where we have to find where it's most successful for you. I usually find if you're in a caloric deficit, like maybe we take it like a 6 weeks, 8 weeks is sometimes where it's like yes, we probably need to take a a caloric vacation from that. And then if we factor in again, a lot of times in the real life, it's like lots of holidays come up in that, right? Where if we're like from Halloween to Christmas, you're in more of a caloric deficit, and then you're taking a break till the new year and things like that. But that's the thing is there's no clear data on what the perfect solution is, right? We just know that it should exist. And then we're trying to find where it works best for you based on all the different things, probably in the context of your life. But yeah, if you have any other questions about that, yeah, I'll do my best to answer. I think that there is just sadly there's more gaps. The weight maintenance data is still unclear. Where we're like, we know these things may help, we know these factors hinder, but we don't have a clear solution. We're still trying to figure it out. So going back into calories, right? We're gonna learn how to calculate our calories here. So calories absolutely matter. You cannot lose weight without being in a caloric deficit, right? Our body has to be in a caloric deficit to lose weight. But as we kind of mentioned before, there are a lot of hormones that affect our hunger and satiety. These can be like our appetite hormones, or we also know even our ovarian hormones, our thyroid hormones. There's lots of different hormones that affect that. We typically want to see weight changes happen. I know for so many people, when I calculate the weight loss, even at a 500 calorie deficit, they're not pleased with 4 pounds per month. But the reality is we don't tend to see success. Again, different if you're on medications, because sometimes when people go on medications, we're comfortable with initial weight loss to a greater degree, but then eventually, of course, it slows down and people plateau. But we want to be realistic as to what this actually looks like. Two people eating the same amounts of calories can experience very different metabolic responses. And again, so many reasons that we can see that happen. So, maintenance calories. So, of course, there's more than one calculation around that. The best one that I've seen is this Mifflin St. Jour equation. So this is one absolutely you can find it online. It's basically taking your weight in kilograms, your height in centimeters, and your age. So I put in the female equation is different for males. And the example here is a 5'2" female that is around 150 pounds. This is calculated to be the resting energy expenditure. So some different people say it as BMR, basal metabolic rate. They're very close to being the same thing. So resting energy expenditure, the number of calories you burn at rest without moving, right? So for basically your body to function. So it's really important to know what that level is. The challenge with just doing the equation is it doesn't account for body composition, because we know that lean tissue burns more calories than fat tissue, right? So more accurate representations of your resting energy expenditure would be something called like an in-body scan. That's something we do in the office. Insight imaging, now you can pay for a DEXA scan. And so this will do body composition. I think it actually even might do bone density, and it will give you a more specific, accurate representation of your own resting energy expenditure. So once we calculate that value, we want to account for activity. So when we account for activity, I always remind people, like this is a very common thing that I see, we have frequency bias as to how much we move, right? If you go to the gym 4 times one week, 1 time the next week, 2 times the next week, are we going to the gym 4 times a week? Or are we going to the gym maybe 1 to 2 times per week? And this actually makes a big difference as to how we calculate your calories. So typically the equation, so if you're sedentary, basically no movement, you multiply that value, that resting energy expenditure by 1.2. Olympic athletes, we multiply it by 1.9. I typically multiply it by 1.3 for most people. So this is more of that lightly active. So it's accounting for 3 days a week exercise. right? It's very hard for even as a clinician to understand how intense people's exercise is, exactly how many minutes they're doing, what type of exercise they're doing. But when we go back to the effect of exercise, exercise is typically not what's shifting the weight loss, it's the caloric deficit, right? So for most people, keeping at that 1.3 is a pretty decent representation as to how many calories they should eat. So REE times 1.3 gives you maintenance calories. This should be the value that if you're eating this in a day, you should not gain weight, right? If you're gaining weight, we got to go back to the drawing board and we got to recalculate what that looks like for you. Then we put you in a caloric deficit by subtracting between, say, that 250 to 500 calories, depending on what we're trying to achieve for people. So, do we track our calories? This is a really hot topic in my weight maintenance group right now because a lot of times people view tracking calories as punishment, right? Ugh, I don't want to do it. It's tedious. It's a task, but it is so great for building awareness and it gives us good data. So we can do this in different ways. I think the challenge is when we don't do it every day, we fall out of the habit. And when we fall out of the habit, we tend to go, it's all or nothing. We do see people that track their calories are way more successful with their weight. And this is across the board. So people that track 6 times a week are typically better for weight loss and weight maintenance. 3 times a week is typically the minimum we see the success at. Of course, this looks different for every individual because if you're really good during the week in terms of you do the meal prep, you eat the same things, you know exactly what you're doing. For those people, maybe it's like finding the gaps, right? Where are your blind spots? Maybe it's the weekends where there's less structured eating, you're eating at a restaurant, you're doing takeout. I know even for myself when I track and you get takeout and you're like, I thought this was healthy. And then you're like, dishes with coconut milk are like through the roof with calories, right? Like in different types of cuisines. So sometimes it's just like finding where those blind spots are, and that can be incredibly useful. It's also helpful, of course, for portion literacy, making sure we know how much you're actually eating. We also know that typically when you track, you make better choices, right? We know it's kind of like a report card at the end of the day. We tend to stay more on track when we're tracking, which, yeah, that's a lot of tracking words. But it is a very useful tool. So now we're going to talk about the foods. Protein. There's protein. Everyone's talking about protein, right? My husband bought me water from Costco and it had protein in it, 4 grams of protein, which makes very little sense and not recommended. But protein has really become very noisy. It is worth the hype though, right? During weight loss, typically we need 1.2 grams of protein per kilo of body weight. However, another accurate value for some people is once we know what your actual lean mass is, so we do this potentially from like an in-body scan or the DEXA scan, is 1 gram per pound of lean mass can also be a decent representation of how much protein you need. When it goes to weight maintenance, sometimes we can drop that protein a bit because when it comes to weight loss, we really want to maintain your muscle because your muscle is what keeps your metabolic rate higher, right? Protein is also so good at helping with satiety. Your body is very smart. It can detect a protein deficiency. And oftentimes, when you have underfueled with protein, it will cause you to crave more foods. So, this is where, when we're like, yes, breakfast is so important for getting enough protein. I've seen a lot of individuals where we actually do your highest amount for the day is with breakfast, less with lunch, less with dinner. It's incredibly hard, but it is a very great tactic to make sure you're getting enough protein and helping with your energy and satiety throughout the day. We also know it has the highest thermic effect. So that means you burn more as you're breaking down protein in your body. Next is carbs, last is fat. So that means you burn less calories metabolizing your fats. Um, so we want to make sure, yeah, protein is the real hero here. Lots of people have questions around the types of proteins, the sources of proteins, and I know that is a big conversation. I think number one, I always focus on getting enough, and then we break down sometimes the sources in which you're getting the protein. I'm just gonna check here for more questions. This is from Shelly. Okay, Shelly, do you want to unmute yourself here just to make sure I'm understanding your question? It sounds like you're asking, is it around like how many calories you should have if we're seeing increased muscle mass and potentially increased metabolism through exercise?
Hmm. I'm just wondering, like, so based on what you're saying and the calculations and stuff, if you're gaining muscle, and so my goal is more about gaining muscle and bone health and things like that through what I'm doing, to calculate the weight loss, how do you know what you're doing? Like, as you because you're going to gain because muscle weighs more, better bones weigh more, right? So how do you know how to calculate that at that point?
Well, I think that that's where potentially it comes with some trial and error, right? Where weight loss is not like here I am giving you equations, but weight loss is actually not a fixed equation. It's variable. And all of this context does matter, right? What type of exercise, how much exercise, how your muscle mass is changing. So, what's really cool is one, we can monitor it. So, for example, on that in body scan, we can see how muscle mass changes and how that actually impacts your resting energy expenditure. If we see your resting energy expenditure drop or your muscle mass drop, then that typically affects the amount of calories you should have in a day. So another variable that's coming up is if you find that, we've calculated you should eat 1,500 calories and based on your exercise, you're like, I'm starving and I'm tired. I feel like I'm not eating enough, then it actually should warrant more like maybe we do need to add in more calories. Maybe we do need to add in more carbs because if you're too tired from not eating enough, then again, that's not going to be a realistic or sustainable strategy for people. But I think it's more like we have to come back and reassess. It's not going to be the same throughout anyone's journey. And I think that just, again, adds in that layer of complexity that we have to keep reevaluating and see what works. If you're gaining weight, then we gotta shift things. But if you're gaining weight and the fat mass has decreased and the muscle mass has increased, we will see that shift in things. So that's just maybe about more assessment through the tests. Did that help, Shelley? Do you have any more questions about that?
No, that's good thing.
Okay. So fiber. I am so obsessed with fiber. So when we're thinking about fiber, it's really important that we're differentiating. So there's insoluble and soluble fiber. Soluble fiber is the real hero when it comes to your metabolic health. So soluble fiber is really good at regulating your blood sugars and actually helping to reduce cholesterol levels. So when we think of soluble fiber, it's the fiber, you drop it in water and it thickens it. So this is your Metamucil and your psyllium fiber, your oats, ground flax seeds, chia seeds. A really awesome one is called hydrolyzed guar gum. So a popular product for hydrolyzed guar gum is called the Fiber 4. This is you can buy at Costco, but these are exceptional as like a soluble fiber source, especially per serving. Overall, though, we want to include fruits, veggies, wheat, bran falls in there. All fiber is important because it's also helping with your digestive health and bowel regularity. But yeah, especially ensuring that you're getting enough of this soluble fiber is really important. If you're not getting enough from your diet, essentially, I just have people supplement. Or add a little bit when you're having it with food. It's so beneficial at that blood glucose and lipid regulation. So this is where, yeah, you're sipping a Metamucil cocktail with dinner, and that can be hugely beneficial for people. The range from the 25 to 38 is, I should clarify that it's female versus males. So females, typically we want to aim for 25 grams. We still want that 10 grams from soluble fiber. 38 grams it is more specific for males. And again, maybe they're like the 10 to 15 grams of the soluble fiber. It's cool because there actually are a lot of high protein, high fiber foods, right? Our beans, our legumes, our edamame, are there's lots of even now breads that are like high in psyllium fiber and also high in protein. So there's lots of great combination foods where we can do that, because the important thing or variable when it comes to protein is we typically don't want all of our protein from animal products. Animal products come with higher saturated fats and calories. And when we think about over consuming those come with like higher lipids and other risk factors or inflammatory long-term inflammatory effects. So finding good high protein, high fiber sources is really good at balancing that. Our hydration. I know this is so basic and it's boring, and drinking enough water is like everyone's least favorite thing, mine included. But dehydration really it can be mistaken for hunger, right? So especially when we're thinking of the winter months, we don't have those same thirst cues, even though we're typically in very dehydrating environments. When it's cold outside and we're cranking up the heat, it's dehydrating. Most of us will wake up, especially, after a long night's sleep, and then we're like, our skin is dry, our mouth is dry, our environments are so dry, and quite simply, people are not drinking enough water. This is not only going to help with, of course, potentially balancing those appetite cues, but it's also so good and important for your overall digestion, potentially headaches, fatigue, all of those important things. So yeah, make sure you're getting enough hydration. I know people ask, do you count herbal teas? Do you count decaffeinated drinks? I mean, I personally do. I think however you can get hydration in is a huge win. So why things still feel hard? There is so many variables that come into it. Our hormones, that metabolic adaptation piece, right? That fight between uncoupling our physiology with weight loss, driving our hunger hormones up and our resting metabolism down, the body composition, sleep, fatigue, specifically hormonal transitions, big life transitions, and stress. I think we find people are peak energy and capacity, and they spent a lot of time working and are often deep in their careers. And this is often when we see the biggest shift in our weight is through a big life transition. And then there's so many other variables on top of that. There's also that genetic piece. So when we're thinking of the genetic piece, yes, there are markers that we can test to see if people have specific genes. An easy way to see or evaluate if there is potentially a genetic component is sometimes just looking at the people around you in your family. Does your body look similar? Does your body look different? How did your parents' body change, or your siblings, or your aunts and uncles, or your grandparents? If there is similarity, likely there's a genetic component factoring into this, right? And this is what we actually have to uncover and really have to take into context when we're looking at weight loss and weight management. So, I have a weight management group. It will be launching the second round in May. And so this group was created to help support and educate people on all of these barriers that come with weight loss. The reason that it's 6 months is because essentially there's very strong evidence to show that when you're in a group format, weight loss is actually more successful. It helps people be more accountable. It helps people share their stories. I think it's really magical in my current group how everyone has such valuable input. They're sharing their stories, which helps someone else. They find, great protein foods or fiber foods or recipes, and they're able to really share that with other people. The community connection is so, so valuable. In this program, we do use RX Foods. So RX Foods is the AI clinician food tracking, where it's when you take a picture of your food, it's able to assess the contents of it. We include in-body scans to evaluate body composition. And then for people that would be right for the program, I do offer weight loss program tax receipts. So this would be a letter confirming your enrollment, that you meet the criteria for weight loss support, and then that's something you'll be able to submit with your taxes. So Brenda, yeah, popped it in the chat here. If you're curious about this or you want more information, I do have a wait list. So I'm going to drop all the information on this either later today or tomorrow. And then you can book a free consult with me if you want to talk more about it. Yeah, Lindsay, such a good question. Likely, yes, there's a genetic component. And I think that when we think about, yes, we know being sedentary may impact your weight, but it's certainly not the only thing. Because going back to exercise alone typically is not enough to manage weight. So likely there's a large genetic component if there's a similarity within your family. Yeah, good question, Lindsay. Um, so that would be obviously be difficult. The RX Foods is interesting because even if you kind of know some of the things in it, or you have a link to a recipe, and there's absolutely more tracking apps than this, then yeah, a lot of times if you can link the recipe, then you'll get a good idea. The RX Food app is so cool because when you take the picture, it like can evaluate like the depth, the serving size, and then you can just plop in the food that you see, and it does a relatively good job at assessing the contents of it. Yes, totally, Brianna. We will be sharing the recording. Absolutely. So you'll be able to see that and go back to it for sure. And that's it. Well, does anyone else have any questions or any other thoughts about anything that we talked about today? You're welcome to unmute yourself.
See, wondering what you talked about the commitment it takes over 6 months. Do you want to talk more about how often you meet, and then what do
Yeah.
people have to do in terms of investment?
Yeah, totally. So, in terms of how often we meet, typically it's bi-weekly, it's over Zoom. It will be 12 sessions, all around a 6 month duration. And this is again, those more frequent meetups are so good for the accountability and connection piece. The investment is billed per session. The enrollment is 155, and that just activates the RX Foods and the in-body scan, and then it's billed per session. So you do commit to the entire program, but it's $95 per session for the program. There's someone else here.
And when are those the meetings? If I wanted to be on the calls with you live, what time of day are they? I'm not sure if you mentioned.
Yeah, I didn't answer that. Thank you. So they're going to be Wednesday evenings, around 7:30. So it starts on May 20th. It's not perfectly 2 weeks over the summer holidays, and I will be sharing the exact dates. Everything will be recorded. You will be given like handouts. You will be given reflection. So not you won't be given tons of homework, but you will be given things to do in between sessions again to kind of keep everyone on the same page to make sure that we're moving through the goals that each person has. I know the starting of the group is just like setting very realistic goals for the program, even though it's advertised for weight management. We talk about in the first session, it's usually not the weight loss goal. It's how you grow, how we look at weight different, how we uncover all of the things that have been impacting the way people have been looking at their own weight. So there's a lot of layers to this, and I'm happy I will send out for anyone that's interested, I'll send out a lot of the topics that we will be covering over this period. Each session is typically between 75 to 90 minutes, just what depending on the topic that we're covering. Yeah.
And again, we have another question of like, how many sessions is it? So we commit, starts on May 20th. You commit for 6 months, and you're going to meet about twice a month on Zoom.
About twice a month. So it's 12 sessions from May 20th to December 2nd. It's not quite every 2 weeks just because there's a little break over the summer break. To enroll right now, it's 155. And then the first time you're billed for a session would be May 20th, and you're just billed after each session is complete. So there's no upfront, the only upfront cost is the enrollment and commitment to the program. As soon as you enroll, you get access to the RX foods to play around with that. We're able to do your in-body scan just because that will be part of the content that will help us, again, calculate the maintenance calories, the body compositions. Um, you can, of course, you can pay by credit card and then as soon as you're enrolled, you will also get the letter that you will be able to submit with your taxes moving forward, but likely it will be with your 2026 taxes that you'll be able to submit that. The sessions are over Zoom. Yeah, Brenda answered that.
And they're recorded in case anybody misses it, that they do get the recording.
Yes, I think that, well, of course, it's valuable. It's so valuable to show up. I know that it's very hard to commit and be like, I'm going to attend every one. You will have access to all of the recordings. And as I said, you'll still get all of the reflections. You'll still get all of the handouts associated with each topic. And then any questions that come up, like you're able to bring that up in future sessions. There's a wait list available. So I haven't opened, no one's enrolled yet. So the wait list is open, Lindsay. Basically, yeah, I'm enrolling people. I'm gonna send out again all of the information and um you're gonna get that. And if you're interested in enrolling or if you want to book a free consultation to discuss the program, you're welcome to do that. Is Flow? No, Flow's not open on Monday. We're closed Friday and Monday. Sadly. But Jessica, you are if you are a patient of the clinic, then absolutely it's during hours, most of the team is able to help you administer like that in-body scan.
Perfect. That's been on my list of to-dos for a minute. I was like,
Yeah.
off. Wait, are you open?
Yeah, I know. It would be handy if we are open Monday, but no, we're taking a break. But yeah, usually our front desk staff can even run the scan if you want it interpreted. They scan it into your file, so you're able to do that as well.
Okay, awesome. Thank you.
Does anyone else have any questions? Sorry for some of the vagueness.
Dr. Passy, do you want to go back to that calculation slide? Because I think
Yeah,
somebody had been
you guys
like
want the
wanting to,
calculations? Let's do it.
yeah, just to re-hit about how you're doing those calculations.
So, okay, so if you even write down Mifflin-St. Jean equation, there are lots of ways, and I wouldn't say they're like hugely dissimilar. There'll be like a few calorie difference. Because I think there's the Benedict something equation as well. It's interesting. I don't know exactly what equations they tend to use on like different calorie apps, but it feels like they're doing something similar, especially if they're asking for your age, height, and weight. They're usually doing something like this to calculate it. It just, again, doesn't sadly account for understanding what your lean body mass is. And sometimes we do get a bit of a discrepancy. And that's where, when we're counting a caloric deficit or caloric maintenance and we're not seeing the results, that InBody or DEXA scan might give us a little bit more accuracy. Oh, you're so welcome. I'm so happy you all came. Thank you for attending. You guys had really wonderful questions.
Dr. Passy, what's the InBody scan going to show me again?
Yeah, the InBody scan will show you lean muscle mass, resting energy expenditure, and will approximate visceral fat.
And so we want to do that sort of before the program, so then that gives us a
Yeah.
base.
In the early duration, so it helps us with the calorie component. The calorie component is not a hyper focus of the program, but it is a really important educational tool where people will have like a good idea, and we're able to kind of see maybe what you've done, maybe where we've missed, or there's some gaps in what people have previously tried or not tried. So I do find it is a very useful tool. Some people get more than one. I have people that do like a scan. Sometimes they go on medication. We're measuring or making sure that their lean body mass is being maintained, especially being on medication and with weight loss, rather than even the resting energy expenditure, visceral fat. So there's a lot of really cool things that we can measure that are actually not weight related with these scans.
Do you have maybe just from memory, I know you said you'll send them out, but what are the main topics of sort of like the modules that we walk through?
So there'll be like the first session is very goal, values, who you want to become, weight bias, internal and external weight bias. We're going to be talking about nutrition, exercise, all of the treatment options in a lot of details. We'll be running through other barriers. So we talk a lot about like appetite, your nervous system, your hormones, your blood sugars. We talk about weight maintenance. And there's a lot of talk about like how you're able to keep going, like what the barriers have been and how we actually troubleshoot around these things. So people are feeling confident leaving the program as to like how they keep going outside of the program. So I don't want to say we're perfectly mimicking what we would do in a study. We're going above and beyond. We're not just giving like the nutritional or exercise recommendations because honestly, like it's so exercise recommendations we can get from a personal trainer. They're important, but we're looking at more of what these things can do for your body. There is more. I just don't have all the 12 topics off the top of my head because I'm revamping the program. So based on the previous session that people are doing, I've gotten really good feedback, and essentially we're going to go deeper into the material and make sure that I structure it. So yeah, there's just more value to add for the next group.
And does it matter if you're on GLP-1s or not? Like
So
this program for?
no, we do the program. I would say in the simplest way, it's for people that need or have missed out on a lot of support around their weight in healthcare. Ideally, if weight is something that may improve some health outcomes, they're a really good candidate for this program. It's more so I want to make sure that because the number is not the big deal. Some people, again, 5% of their weight loss, it doesn't matter if you're 110 pounds or 210 pounds. It's just I'm avoiding people that want short-term weight loss for a wedding, for a vacation, for something. It's to build skills over your lifetime. People who need support building these skills over their lifetime is who it's for. There are people in the current program, some are on it, some are not. And it's really cool to compare those experiences and share those experiences as well.
And then if somebody, might be considering the GLP-1, is that something you can help them with?
So while I can't prescribe, I'm very good at making sure people can make an informed choice. So they have all the risks, benefits, they know what their options are. So I know how to provide really good guidance and support. I know all the guidelines around people on GLP medications, the differences between them, the side effect, navigating that. So I am a really good resource. I just can't actually provide the prescription.
Awesome. Sounds like a couple of people have dropped off already. They got to go back to work. Any other questions from anybody or last comments, Dr. Passy?
I know I just love having this conversation, and I'm so happy we had so many people come and participate and ask really valuable questions. And I'm here to support anyone that needs more.
Awesome. Yeah, this is definitely needed because we had a huge response to this webinar, which is really good. So it's like people want the support, they need the support, and we're glad you're there to offer it.
All right. For anyone, again, interested, I'll make sure I'm dropping all of those questions. You're going to be getting about the program. You're going to be getting an email specifically from me. So you'll be able to email me back if there's anything else on your list of things or details that you want to know about the program. And I think that, yeah, we're good here, eh?